Welcome to Enhance Health. I'm your host, Elizabeth D'Orazio, and this unique facility integrates medical and psychological and lifestyle changes so we can live well, no matter what we get in our lot in life, genetically, physically, or whatever life has flung our way. One of the unique things about this facility is the use of cutting-edge assessments, whether it's VO2 max set testing, metabolic testing, or even genetic marker testing that helps them craft a unique lifestyle plan that helps us be the best person that we are. So my plan's not gonna be the same as your plan, but that's great. I'm looking for my best health. Right now, I'm joined by the Vice President here at Enhance Health, Dr. Beaver, and she's gonna tell us about the unique assessments that can get us on the right track. Thank you for joining us.
Happy to be here.
Now, this really is a unique approach to healthcare because each one of these assessments kind of nudges us in the right direction. You've got this first basic one called the lifestyle assessment. Tell us a little bit about that lifestyle plan.
So that is an assessment that is comprehensive, looking at all aspects of lifestyle. So we really want to focus on nutrition, physical activity, stress management, sleep, and the psychological underpinnings that are driving a lot of those behaviors and choices. So really doing a state-of-the-art evaluation of each one of those individually to put together a comprehensive plan that's individualized to the patient.
And the neat thing about this is there's a follow-up visit to see how we're doing and what we need to tweak on that too. It's not just you're out the door and you're gone.
That's right. So the patient comes in, it's about 2.5 hours. We do some assessments on the digitally. Then we do a history and do some other testing. We do this, and we meet with you can meet with a psychologist, you meet with the medical practitioner. And once we gather all that information, we send out for the genetic testing, we gather all that information, we formulate a nice portfolio that summarizes everything, and we bring that patient back in and we meet as a team. And we collaborate on it and talk to them and figure out what their goals are, what their results are, and how we can align those results with achieving their goals.
And each of these other following assessments we're going to look at are kind of like little more specific versions. Like we have a mind-body one that really focuses in on the VO2 max connection between that and our personal metabolic assessment. Tell us a little bit about that.
So the mind-body, as you said, really combines our physical fitness with our psychological fitness. So we look at both. And VO2 max test is a really great way to look at cardiopulmonary fitness, how well our heart and lungs are working. And we can use that information to help formulate fitness plans and really assess how healthy a person's heart is. We use that. We look at the metabolic analysis, including body composition. So we look at body fat percentage. We look at resting metabolic rate, and we can use that resting metabolic rate to help guide people with goals around weight. If they're interested in maintaining their weight, if they're interested in losing their weight, we can use those numbers to help guide that.
And you even have one that's even more tailored. So that's like a good overall in terms of finding that mind-body connection. The Scholar Athlete, I can see where this is up here in the Dartmouth region is going to be very popular. This is for people that are really looking at their body as a well-oiled machine. You're going to take that performance to the next level.
That's right. So there are so many active people in the Upper Valley and really that have really strong athletes of all ages. And what we really want to do is help them enhance that performance by helping them find the most efficient ways to exercise, to find the most efficient ways to train, and really to enhance their performance across all avenues of their life. So whether they're students and they want to perform both in the classroom as well as in the arena, or if they're professionals and they want to enhance their performance, again, outside of their physical activity.
And that brings me to I think my favorite of all of yours, which is the professional health one. And this is for the career person. You know, we get in a groove, we like our job, we like what we're doing, but we don't realize that perhaps the way we're managing that, whether it's from posture to diet or stress, can have an impact on our health. You have something called the professional health assessment that really talks about living healthy throughout your career.
That's right, and it really is catered to those professionals that value their time. They want an efficient, comprehensive healthcare evaluation, perhaps on an annual basis, where they can come in and, again, with the one-stop shop, receive a complete portfolio on their health, looking at both the medical issues, whether it's their lifestyle issues as well as their psychological issues, and tying it all together for them to help them, again, perform as best as they can, both in their career and in their personal life.
One of the things you do here on your women's health assessment is, rather than have everything sort of scattered and hope that you're putting together the pieces, you literally look at putting all of the aspects of women's health, whether it's stress, genetics, hormones, etc., and you bring it all into one thing during your women's health assessment as well.
That's right, and I think that particular summary really highlights one of the features of the clinic, which is time. We want to take the time to really put together everything, really listen to the patient, hear what the patient's concerns are, and take all of the information and put it together so that everything kind of makes sense instead of looking at it from a fragmented view.
And there's even some simpler assessments that can really augment the care we're currently receiving. The nutrition and health one. I mean, who doesn't need a nutrition assessment to make sure that, food is the best medicine? That sounds like really something anyone could utilize to start their relationship here, or even just, like I said, augment the care they're currently getting.
Yeah, I mean, I think this is appropriate for everyone who's not confused by the internet and by all of the information out there.
Eat this, don't eat it, that will kill you.
Exactly. So really, what is the right thing to do? And so we really want to look at that both from a global standpoint, looking at the guidelines, which really are as simple as eating whole healthy foods, and what does that mean, to precision nutrition. What are the genetic predispositions that you have, and how can we align those with maybe foods you're interested in, maybe foods you don't like, maybe some food intolerances, and how can we put it all together again in one full package so that you can have this personalized nutrition plan that again helps you feel as healthy as well as you can.
And to wrap up, really the best thing to mention is the continuity of care. So once we've come up with a plan, there really is ongoing support from either a medical or psychological team approach throughout this process as we go on through the years.
Certainly. I mean, patients can choose to come in here just for a medical doctor or nurse practitioner, really just to receive adult primary care, and other patients may come here just for psychological services. And the third group are patients that want to utilize the whole package. Any of those choices is absolutely fine, and we are happy to develop relationships with patients so that they feel like this is a very comfortable place for them where they can receive that care and receive it in an efficient and very confidential way.
I want to thank you for joining us, Dr. Beaver, and hopefully you realize that the many different approaches and assessments that Enhance Health offers can help you live well and free.